Hello, my name is Ryan Law. I'm on faculty in the Division of Gastroenterology at the University of Michigan. On behalf of my co-authors, I would like to introduce our manuscript entitled Endoscopic Resection is Cost-Effective Compared to Laparoscopic Resection in the Management of Complex Colon Polyps, an Economic Analysis. This multi-center study was performed while I was an advanced fellow in therapeutic endoscopy at Northwestern University. As we know, endoscopic resection remains the preferred treatment modality for complex polyps, yet many patients are still referred for surgical resection with cited concerns including number 1, procedural safety of endoscopic resection, number 2, incomplete polyp resection, and number 3, adenoma recurrence following endoscopic resection. While both resection strategies are clearly efficacious, there is a paucity of data on the cost-effectiveness of each modality. Thus, we chose to perform a cost-effectiveness analysis comparing laparoscopic and endoscopic resection strategies in patients with complex colon polyps. Additionally, we sought to identify predictors that determine cost-effectiveness. We created a hybrid Markov model with a 10-year time horizon in which hypothetical patients entered the model following initial endoscopic diagnosis at 50 years of age. Patients assigned to the endoscopic resection strategy underwent attempted polyp resection followed by surveillance colonoscopy at 3 to 6 months and 12 months. Patients with failed endoscopic resection and residual adenoma at 12 months underwent laparoscopic resection. Alternatively, patients entering the laparoscopic resection strategy underwent surgery as the initial treatment for complex colon polyps. As shown in this table, estimates with regards to endoscopic resection, specifically technical success, adverse event rates, and persistent adenoma rates, were obtained by performing a systematic review of all published literature on this topic. We utilized Centers for Medicaid and Medicare Services data 2012 to 2013, along with the 2012 Healthcare Cost and Utilization Project data, using a national inpatient sample to determine costs using respective CPT codes and loss of utility. Our results have demonstrated that laparoscopic resection was more costly and yielded less quality-adjusted life years in comparison to endoscopic resection. The costs associated with endoscopic resection of a complex colon polyp were $5,570 per patient, yielding 9.64 quality-adjusted life years, while laparoscopic resection to treat a similar polyp cost $18,717 per patient, yielding fewer quality-adjusted life years of 9.577. Thus, there was an incremental cost of $13,147 per patient under the laparoscopic strategy. One-way sensitivity analyses have determined that our model was most sensitive to age, technical success, and adverse events rates, as well as costs of laparoscopic resection. Our findings clearly demonstrate that endoscopic resection is a more cost-effective strategy for the management of complex colon polyps. A recently published manuscript by Jayana et al. From the Australian Colonic Endoscopic Resection Study Group has validated our findings. Their study demonstrated a cost savings of greater than $7,500 per patient when an endoscopic strategy was employed. Given these results, along with the efficacy of endoscopic resection, we believe that laparoscopic resection should be reserved for complex colon polyps with characteristics concerning for submucosally invasive cancer, those polyps likely to result in an incomplete resection, or recalcitrant or recurrent polyps after 1 year of attempted endoscopic resection. We thank the editorial team at Gastrointestinal Endoscopy for the opportunity to showcase our work and sincerely believe that this topic will be of interest to the readership. Thank you.